Hello, I'm Dr. Shuddha Sen, Senior Consultant, Surgical Gastroenterology, GI Oncology, Laparoscopy and Liver Transplant, presently associated with AMRI Thakuria Hospitals, Ashok Nursing Home in Jodhpur Park and KDQ Center being my chamber. I was a former Senior Consultant with the Fortis Group of Hospitals, Director of Medica and Apollo Group of Hospitals. See, the point is, whenever somebody asks me this question, I face this question multiple times at many sessions, talks, CMEs, awareness programs. What I always say is the best way, not just for a doctor, for any professional, is look at few things. Because there are two ways to look at anything: objective, that is which is supported by evidence, or which is subjective. Subjective is a perception which is very relative, and that may not be the right choice. So looking at it objectively, first and foremost criteria, what I say is look at the qualifications of the doctor. Because a super specialist would always be more qualified, more experienced, more expert and more skillful in handling a difficult situation. So first is the qualification, then from where the qualifications have been achieved, that is training center is very important. What is the experience in years of the doctor? Not always that a very aged surgeon would be very experienced, but it also depends on in which field the doctor works. Apart from that, also look at the feedbacks from the doctor's hospital, from the doctor's colleagues may not give you always a very right view, because there may be competitive or conflict of interest. It is best to ask the staff of the hospital where the doctor works, the OT staff, the anesthetists who are at the head end of the surgeries, the previous patients about their feedback. And definitely once you have chosen the doctor, you go to the doctor with faith and ask and clear all your doubts. If the doctor is very comfortable in clearing all your queries, and assess the doctor's also confidence in handling the queries and explaining to you in clarity what is the disease, what do you do for it, what is the treatment and how do you go forward. So all these things would actually add up to the doctor's credibility. There are also, you can go for the Google review, the blogs, the websites, the social media sites, but not always you would get a very right feedback. Though many times you would get a right feedback, mostly. But not only go through the stars or the ratings of the doctor, but also go through individual reviews and see how the patients or the previous patients have been comfortable or has expressed their opinion about the surgery and what sort of surgeries has been done. So it is a wholesome approach to go to a doctor. And what I always tell is choose a good doctor. You choose, say, 10 options. Of these 10 options, you narrow down based on these features that I have told you, and then go for one or maybe go for second and third opinion, and then you discuss and decide which would be the best for you. It is neither the hospital nor the location nor the fame that would actually decide the fate of the patient, because a very good surgeon once in a while may have a mortality. Relatively inexperienced surgeon may save a very critical patient which have been failed by others. So not exactly for the critical, very complex cases, you have to do a lot of homework, but relatively simpler cases or cases where outcome is relatively easier to deliver, in those cases you just follow these above things, discuss, and then you decide on the doctor. But what I would suggest is, doctors are also human beings, so whenever you have faith on them, just definitely have faith and discuss all the pros and cons. Now, doctor would always try to take your patient out, bring him out healthy and discharge the patient healthy and have a long-term follow-up. But do at time to time clear your queries with the doctor so that there is no miscommunication, because communication is very important, faith is very important, knowledge and qualification and skill is very important for a proper treatment of your beloved ones. Last but not the least, I would like to say the way I, Dr. Shuddha Sen, would always been with my patients is I believe in 3 words. That the best way to practice is truth, trust and expertise. You be true to your patients, let the patients also be true to you with all facts. You must have mutual trust to fly through, and you must be good enough in skills, knowledge, qualification, that is expertise. All 3 combination would actually culminate into the best possible outcome.